Hello, 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 and welcome to Thursdays with Whitman-Walker. Welcome, welcome, welcome. Come on in. Thursdays we talk with Whitman-Walker about different topics. So today's Thursday, so join us. I'm going to get started in a few minutes. Good morning, Brendan.
What's going on, Orlando? How are we doing?
Doing good. Getting home right on time to get live.
Oh, you were in work today?
Yeah, I've been going into the office these days.
Is that nice or
It was a little bit of getting used to, but now that I'm in there, I'm like actually a little happy that I'm more active than being, home.
it was also so nice to go this week just because it was so warm outside?
Oh yeah, the weather's great. Weather's definitely great. What's up, people? Come on in. It's Thursdays. We're doing a live with Whitman-Walker. For those of you who don't know, I'm a social media influencer with Whitman-Walker. So we do weekly chats about different topics. So today we have a new topic to talk about. Um, so come on in. Come on in. Don't be shy. Share the live if you know anyone who wants to listen about treatment as prevention. If you don't know what that is, stay tuned. We'll be talking a little bit about it. So come on in, come on in, come on in. Don't be shy. And we'll get started in about 20 seconds. All right. So pretty much today we're going to talk about a really new technology used to prevent HIV treatment. That's right. By treating HIV, we can prevent new infections. It's called treatment as prevention, abbreviated as TasP. So TasP means that by treating people who are living with HIV with effective medication, can prevent transmission of HIV to their sexual partners. So if you are not aware of it or this is your first time listening about it, yes, being able to treat HIV and keep someone healthy and undetectable will very much help not transmit HIV to your sexual partners. So before we dive deeper into TasP, let's back up a little bit and talk about HIV. So for those of you that don't know what HIV is, it is the human immunodeficiency virus. It is transmitted through the exchange of body fluids such as blood, semen, vaginal secretions, rectal secretions, and breast milk. Fluids like tears and saliva do not carry HIV. Most HIV transmissions occur during anal sex with men who have sex with men, but a number of people get HIV from vaginal sex. So, injection drug use, pregnancy, breastfeeding, and childbirth. So, some people can actually get these things by, just through birth. So, it's not really as much as you guys think it's only sexual. It could be through drugs, it could be through needles, sex, breast milk, and like I said, also through birth. So you can prevent against acquiring HIV by using condoms, taking PrEP or PEP, using clean needles, or by choosing not to have sex or injection drugs at all. So there is no cure for HIV. We have a lot of tools to manage the virus. If left unmanaged, HIV destroys your immune system and it leads to autoimmune deficiency syndrome or AIDS, to what you guys have heard, which can turn and leads to death. In the 1980s and 1990s, we did not have a very good way to manage HIV. As a result, so many people died of AIDS-related complications. But now we have a really solid care options. So, in fact, if someone with HIV takes their antivirals, they can live a normal, healthy life. So, if you guys have any questions or anything that you missed, go ahead and just ask in the comments, and I'll be more than happy to repeat what I said. Um, Definitely don't be shy. So, like I was saying, if someone with HIV takes their medications every day as prescribed for a long enough time, they reach a point where they become undetectable. Undetectable. All that means is that if someone did have HIV test on that person, the test would show that they are HIV negative. That's pretty wild. How can a test show that someone doesn't have HIV when they really do? Well, that's because an antiviral medication works so well at suppressing the virus that the body and decreasing the viral load that the test can't recognize their infection. Hello, hello, hello. So when someone becomes undetectable, it's not only good for them and their health, but it's also good for their partner's health too. So someone who is undetectable cannot transmit HIV to other people. Again, because the viral load is so low that it will not get passed along. Hence the term U equals U, which is undetectable equals untransmittable. So that means that someone with HIV who is taking their medication as prescribed can't give HIV to someone else. Hence the term treatment as prevention. So by getting treated for HIV, that person is also preventing the spread of HIV because their undetectability means that they cannot transmit the virus. It's very cool that U equals U works with every mode of HIV transmission. That includes unprotected sex, sharing needles, pregnancies, childbirth, and breastfeeding. So an important part of U equals U framework is that it only works when a person living with HIV takes the medication exactly as prescribed, has a regular follow-up care, including regular undetectable, you say that, and that you stay that way forever. If you stop medication, you quickly become detectable again and have the capacity to spread HIV as well. That is why continued treatment is so, so, so important. So don't forget, guys, if you have any questions or missed something, please, please ask away. I'm more than happy to answer your questions. And if I can, I'll get back to you with the information you asked. So in case you don't believe me, I can point to a large research studies with newer HIV medications that have shown treatment indeed is prevention. These studies have monitored thousands of couples in which one partner was positive and the other was negative. No HIV transmissions were observed when the HIV positive partner was virally suppressed. This means that if you can keep your viral load undetectable, there's no risk of transmitting HIV to someone who may have vagina, anal, or oral sex. So TasP, and for those of you who just got me, TasP means treatment as prevention, can be used alone or in conjunction with prevention strategies, which means you should also talk about your HIV status with your sex partners and decide together which prevention methods you can and will use. If you have HIV and you're looking to get treatment so you can stay healthy and prevent the spread of HIV, please call Whitman-Walker and get connected to one of our care agents at 202-797-4439. The number's in the comments. So make sure if you have any questions or you've never gotten tested or you think you might need to get tested, the sooner the better, because the quicker you get on treatment, the safer it'll be for you in the future to stay healthy and for any sexual partners as well. So if you are not sure of your HIV status or just want to get checked, Whitman-Walker offers free HIV and STI testing at our Liz location in Northwest DC and our MRC location in Southeast DC. You can make an appointment by calling 202-797-4439. Again, the number is pinned in my information. So take a picture of it. It's right there. It won't save when I put the video up later. So take a snapshot of it now or send me a DM, or you can send that DM to Whitman-Walker as well. So any questions in here? Let's see. Let me scroll the comments real quick. Thank you guys and ladies for joining us. Appreciate you. Don't forget, ask away, ask any questions, or if you're shy, just DM me. Looks good. I don't see any questions. But make sure all the information Whitman-Walker is posting is for you if you have any questions. So look, looks like we're good. Now, as I wrap it up, I'll remind people about sex and other viruses, COVID-19. As we know, COVID-19 is a virus that can spread when you are within 6 feet of a person with COVID-19 who coughs or sneezes. So if you come in within 6 feet of someone, like when you're getting intimate with someone, you're putting yourself at risk. So when it comes to having sex, you are the safest sex partner. Masturbation will not spread COVID-19, especially if you wash your hands and any sex toys. Make sure you use soap for at least 20 seconds. before and after sex. So make sure, you know, we all love sex, so we're not sex shaming. You know, we need what you need. Just make sure you be careful. Make sure you quarantine with your partner. If that's your, you know, your specific person, great. Just make sure you're not putting anyone else at risk by, you know, being out and about. If you are going to quarantine, quarantine, and before and after, before you have to see any loved ones. So be super careful, because at the end of the day, you can't be 6 feet apart if you're going to have sex with anyone, and that's a given. All right. So remember, social distancing is definitely a way to reduce the amount of COVID-19 transmission. It deliberately increases the physical space between people to avoid spreading the illness, especially around any, you know, special days, special holidays, where many people are used to traveling. Make sure that you are staying at least 6 feet away from anyone when possible. Wear your mask in public. Avoid eating places with large crowds. Encouraging to work from home if possible. Speak with your loved ones over the phone or FaceTime. Social distancing as caring for your community. Stay up to date with your local, state, and national guidelines for testing, quarantine, and general safety. Washing your hands for at least 20 seconds at a time. Staying home if you don't feel well. And just to touch base what we talked about last week, make sure you're registering to get your vaccine as soon as possible. Go on your state website and see when you're able to register, and you know, check on your older family members. Check on your older family members to see if they have gotten registered. If not, make sure you get registered for them. All right, I checked up on parents, got registered for them. Make sure you get registered for your, you know, people that maybe don't speak English or are not very computer savvy. Get find out what information. If they're older, please get them vaccinated first. You know, they're every state is different. They're telling you what stages are on right now. So if you have any questions, please feel free to, you know, DM Whitman-Walker, or if you just want to ask me, I can forward that question along for you. So follow us on Whitman-Walker, Twitter, Facebook, and Instagram at Whitman-Walker and Real Talk DC _ to stay up to date with all things Whitman-Walker. As always, I appreciate you all. We are here. We see you. And if you have any questions, don't feel bad. Please, people DM me all the time. They're like, hey, I kind of feel, you know, sad about asking this, or like shy about asking this. We're not here to judge you guys. We're here to get you the information you need, testing you need, and treatment if needed. All right, guys. So make sure you stay safe, take care of each other, reach out to each other. You know, everyone is different on these weird times. Enjoy the weather, not too much. Make sure you're safe. And I appreciate you. We see you. Thank you so much, Brendan.
Thanks, Orlando. Have a nice night.
All right, you guys be safe.